Palliative care is a burgeoning specialty in and of itself, recently with its own special boards for certification that addresses symptom management in patients with chronic diseases, much the same as hospice does. They're sister specialties.
A lot of hospitals now have palliative care services. They may actually go through your chart, see if you meet a criteria for palliative care, maybe then approach your primary care physician and go, is this a good patient for palliative care? These are things that we can offer you to assist your patient and assist you as the physician.
It's a consultative service in that usually a palliative trained physician and or an experienced palliative care nurse practitioner does a complete assessment of the patient from head to toe, and they make recommendations as to how they would manage this patient's symptoms. And their recommendations are made to the attending physicians. We don't actually take over primary care of the patients. The attending physicians maintain that care. They still write their prescriptions on the patients, but they very often will implement our recommendations and put them in place.
So palliative care has a little bit more discretion about how they treat their patients. They may treat things a little differently, different medicines for the same problem that maybe a primary care either wouldn't or wouldn't feel comfortable with. And they will often refer patients to palliative care for that very reason.
The medications that I often have to use in large doses to alleviate a patient's pain are medications that physicians who are less experienced with those medications are fearful of using, for fear it may accelerate end-of-life experience, when in fact they do just the opposite. And once physicians see that, they realize that we are partners in this. They're still part of their team. They've been their attending physicians for years. That doesn't have to stop. I would say to the attending physician that palliative care is an adjunct to their specialty. We achieve a patient who's clinically better managed, whose symptoms are better managed, and who is more comfortable overall as a patient, which is our goal. That's what we can do together. As a team, we're better than either one of us are alone.